In Chapter 12, we will be going over helping the injured athlete psychologically. So there are mental effects of injuries in addition to physical effects. An athlete's mind is also affected when the body part is injured, and we don't want to ignore that. We actually spend quite a bit of time in our spine clinic training on how to help patients psychologically, because a lot of pain that people feel has to do with their emotions surrounding their injury, their life in general, things like that. Any negative psychological responses to injury could result in a longer and more difficult period of rehab. Basically, if somebody has a better attitude about their injury, about their rehab, and about their life, they're going to get better faster. Appropriate psychological care provided by the sports medicine team can facilitate the athlete's return to competition. Coaches and fitness professionals working with injured athletes must have an understanding of how athletes react to injuries and to the rehab process. And the manner in which those professionals support the injured athlete can have a dramatic impact on the rehabilitation process. As athletic trainers, we should hopefully be able to have some more information about helping people with dealing with injuries than a coach or fitness professional, just because we're doing that so often. But this is definitely appropriate information for coaches, personal trainers, people going to physical therapy, or athletic trainers. Although you will notice that some of it, the wording is unfortunately geared a little bit more towards coaching. That's just the way the textbook had worded things. All athletes will have a psychological response to injury, but different athletes will deal with an injury differently. So this girl in the picture who's screaming, she just probably injured her knee and she's freaking out a little bit. But it's hard to say why or how somebody reacts to somebody, or how somebody will react to an injury. Some people will view that injury as disastrous. I mean, I've had people just tear the heck out of their knee and they have a positive outlook on life, and they don't see it as being as disastrous as somebody who just got a moderate ankle sprain. I mean, it's pretty interesting how people's viewpoints on life change how they react to injury. Some people will see an injury as an opportunity to show courage, and others will use it as an excuse for poor performance. You always have those people who we just cannot shoo away from our golf cart or athletic training table that just want to hang out with us because they want to be a part of the team, but they don't really want to be playing. Another thing that will affect the athlete's response to injury would be how long the injury is, and how long the rehab of the injury is, and how bad the injury is. So for a short-term injury lasting less than 4 weeks, most people, they just kind of brush it off. It's not a big deal. I'll be back quickly. Most of the time they want to come back more quickly than we want them to, but they'll just kind of deal with it. For longer term or more than 4-week rehab, that changes things a little bit because people realize they have to really put a lot of work in to get better. Chronic or recurring injuries, a lot of people lose hope in getting better. So that's one thing that can be a little hard with chronic injuries. Same thing with career terminating injuries or career ending injuries. A lot of times people with career ending injuries just kind of say, F it, like what's the point of me even trying to rehab this injury? I'm not going to be able to do what I want to do anyways. So that's pretty tough. And that's hard to watch. Really, because I've seen that the difference between a girl who was one of my best rehabs ever, like just so strong. I think she could have probably played at 4 months. We waited till 6 months after an ACL rehab. She was a junior the first time she got hurt. She got re-injured her senior year, first came back, and her response to her second rehab was completely different because it was career ending. So her first rehab, she worked her butt off. The second rehab, she was a lot more relaxed in her commitment to what was going on. She was still pretty good, but just not nearly as superstar as the first time. no matter how long the injury will take to get better, or how long the rehab process lasts, there are 3 reactive phases to injury. First, there's a reaction to the actual injury. Next, there's a reaction to the rehabilitation. And next, there is a reaction to the return to play or termination of career. We'll talk more about all 3 of those. Other matters that must be considered as far as how somebody's going to react are the person's past history, their coping skills, their social support, and their personality traits. So somebody with a personal history of depression is more likely to have a difficult time coping with injury or pain. And, but not always. The individual who I just spoke about, who had the 2 ACL injuries, also had a past history of depression, and I would have actually never guessed until I was sitting with her in her pre-op appointment, and she started talking about taking Wellbutrin. But she kept a really positive attitude. So just because somebody has depression doesn't mean that they're going to be negative about their rehabilitation, but it does mean that they have to work extra hard to keep a positive attitude, oftentimes. Other things like social support, do they have family or friend support, things like that. The injury may impact a number of factors, both socially and personally, and we need to be aware of possible self-esteem issues. If somebody's been an athlete their entire life and then they have a career-terminating injury, that can be pretty crushing to the individual because a lot of times their self-esteem is really wound up in how good of an athlete they are. Also, sometimes people will feel very distanced from their teammates when they can no longer perform at the same level that they did before. And unfortunately, oftentimes their teammates were their closest friends because they were spending the most time with them. So there's a lot of things that go into the social aspect of somebody becoming injured and unable to play. Some predictors of injury would be, so there are some psychological traits that may predispose an athlete to repeated injury. People who are risk takers. I thought this was a great picture of risk taking, backflipping off of a cliff dive. That is a little crazy to me. But being a risk taker can predispose you to repeated injury. Being too reserved. So I will say that most often, if you have a person on the football or rugby field who is the aggressor is usually not the injured person. Usually it's the person being aggressed on. So most of the time if somebody's playing scared, they're more likely to get injured, unless the aggressor is just completely crazy and they're not in control of their body. That's different. If somebody's detached or tender-minded, a good example of that would be at a high school, well, he played football, wrestled, and did baseball, but a high school athlete that I worked with once who was a freshman, and holy moly, that kid was just soft. He was just a really, really soft kid, and he was also really easily distracted. And one time I saw him just get nailed in the face with a baseball because he was playing first base, and the pitcher had been trying to keep the runner on first base probably for about 5 or 6 throws. So he kept throwing back to the first baseman. He should have been paying attention. One of the times he threw back to him, he was just staring into the other team's dugout, just not paying attention. So he ended up fracturing his eye socket because he wasn't paying attention. He was looking into the other team's dugout in the middle of a game. So that would be detached or tender-minded. Apprehensive, again, if you're getting aggressed on versus being the aggressor, you're more likely to be injured. Being overprotective, again, easily distracted. Other potential contributors include attempting to reduce anxiety by being more aggressive, so being overly aggressive, or the person might continue to be injured due to fear of failure associated with unattainable goals. When I was at UCSC, I had a girl, I swear she came out for rugby 3 seasons in a row, and she kept getting hurt, and she would spend a good 45 minutes of practice just hanging out with me on the golf cart. And I would try to tell her to go be by her team, go do what she could do. And I mean, I think part of it was she was just never going to be good enough to actually play. And she'd already been playing for 3 years, but she didn't want to stop playing either. So it was kind of an interesting situation. But she also had recurring injuries as well that were real. She wasn't making them up, but she kind of didn't want to get all the way better either. So injury prevention is physiological and psychological. If an athlete is under a lot of stress emotionally, they're going to be more prone to injury compared to somebody who is well adjusted and not going through that same amount of stress. So examples would be an angered athlete may attempt to take out frustrations on other players and lose perspective and do something stupid and get hurt. The other thing too is that when somebody's under a lot of psychological stress, their skill and coordination actually can be messed up. It can be sacrificed, and that can cause injury. As far as stress and risk of injury, everybody has stresses in our lives. Stress is a normal part of daily living, and stress can be either positive or negative forces that can have disruption on the body's equilibrium. And stress will tell our body how to react. So even a positive stress, so, like say for instance, you're at Miramar now, what if you get into the 4-year university that you really want to go to? It's your number one choice for school. You're super excited. That's still stressful. You still have a lot of stuff that's going to go into having to make sure that you can complete that goal. And even though it's positive stress, it's really hard. Having kids, again, assuming you're ready for them, is a very positive stress, but it's still very hard. And negative stresses are even worse. So like you have a death in the family or things like that, that's just really hard. And our body's going to have to figure out how to react to that. Studies indicate a negative impact of stress on injury, especially in high intensity sports. So increased stress, again, either positive or negative, will result in a decreased attentional focus. We can also have an increase in muscle tension, which reduces flexibility, coordination, and movement efficiency. So again, it's not just psychological, it's also physiological when somebody is under a lot of emotional or mental stress. Sports can serve both as a stress to the athlete and a stress reliever, which is interesting. But a lot of times an athlete will walk a fine line between reaching and maintaining performance. This is especially common in distance runners and triathletes because basically for a triathlete or a distance runner, they're about a half a percentage point away from overtraining. If they're training at an appropriate level, at a high level, they're just about to be overtrained, and it doesn't take much to push them over the edge. An individual must be able to handle outside stressors to be able to perform their best in their sport. So that would include things like personal expectations and stress from school, family, and work. I know, a lot of the students in this class have stress because they have school, family, and work. I've had people who work over more than full time and have kids who are taking this class, and man, I don't know. I don't know how you can be a full or even a part-time student and work full time and have a family. It's very difficult. So, it's a juggling act, and it's something that people have to figure out. Same thing with athletes. Overtraining is a condition that happens when there's an imbalance between the physical load placed on the athlete and his or her coping capacity. So basically, the amount of work that the person is doing is beyond what they can cope with. And there can be physiological and psychological factors with this. This can lead to staleness and eventually burnout. My supervisor at work actually was a collegiate softball player for about a minute at San Diego State. When she was there, the coaches wanted her to gain weight. So they were having her work out 6 hours a day in addition to going to school, and she was working full time. So she got overtrained and burned out really fast. They wanted her to gain weight. She actually ended up losing weight. So she was having definitely some physiological issues that went along with that. And she ended up realizing that there was no way she could maintain working out that much and continuing to do the rest of the things she had to do. So she chose a different path, and she chose to become an athletic trainer, actually, and then later on a physical therapist. So recognition and early intervention with overtraining is really important. For those people who are not going to stop playing their sport, we do want to have implement a short interruption in training, at least 3 to 5 days. So we can do that by having fun practice day or cross training or doing complete rest. For those of you who are going to be working with clients as personal trainers, you might notice this with somebody who maybe their weights have actually decreased and they're complaining about issues at home or at work, and they're just not engaged. They're just not as into the workout as they usually are. That might be a good time to say, look, we're going to take a break from what we're normally doing and we're going to do something fun today, even if it's just instead of doing, squats and lunges and blah, blah, blah. Just have a fun balance day. Go play with some ropes outside. Go throw a ball around with each other, like a med ball. Just something a little different that can help. Or maybe you just do something totally different. You go to the pool and go swimming. Just do some cross training. Do something different. Um, when somebody is in an overtrained state, we should lower their workload but maintain training intensity preferentially. So we might want to try to keep their weight similar, but lower the repetitions until the athlete shows signs of recovery. Then we'll follow with a gradual return to the same workload. And again, this is a short interruption. It's not forever. It's, about a week at the most. But the person should be removed from competition during this time period to allow them to not go into staleness and burnout. We want to try to keep the person as mentally and physically healthy as possible. Staleness is another condition that athletes can suffer from, I guess is the best way to put it. And there can be numerous reasons for staleness, but some examples would be training too long or too hard without rest. So this is more likely to happen maybe at the end of the season, possibly. And staleness can be attributed to emotional problems from daily worries or fears. It could be something as commonplace as the person's still training hard and it's midterms and they're freaked out about their midterms and don't want to come to practice and it's too much, things like that. With staleness, we often will get anxiety, which is defined as a nondescript fear, a sense of apprehension, and or restlessness. So I like this picture down at the bottom of the slide. This would be my picture of a good example of how somebody might look when they're feeling anxious or having anxiety. Biting the nails, furrowed brow, just looking generally stressed. When somebody's having anxiety, they may feel inadequate but might be unable to say why. So with somebody who's suffering from anxiety, you may hear them say like, nobody likes me or I'm no good. And when you ask them why, they'll just say it's just the way it is. They won't be able to tell you why they don't feel like they're useful or good people or whatever. Anxiety can cause some physiological issues like heart palpitations and shortness of breath, sweaty palms, constriction of the throat, and headaches. So basically, the sympathetic nervous system is causing some issues for that person who's having anxiety. Minimal positive reinforcement can make an athlete more prone to staleness. So when we talk about types of reinforcement, there are two main ones. There's positive reinforcement and negative reinforcement. Negative reinforcement doesn't mean hitting someone or calling somebody names, but negative reinforcement actually means just taking something away for behavior. And positive reinforcement is adding something for a behavior. So say, for instance, when I was in high school, a wrestling coach for a specific move that looked very inappropriate and he thought was funny. If one of the athletes could pin somebody with that move, he would buy them a pizza. He called it the pizza move. So that was positive reinforcement. If you pin somebody using this ridiculous move, you get a pizza. Negative reinforcement would have been to say, if you pin somebody using that move, you don't have to run laps after practice. Well, most high school boys especially would be more motivated by getting a pizza than by not having to run laps. Taking something away for a behavior is just not nearly as reinforcing as adding something for a behavior. Our symptoms of staleness would be a deterioration in performance. So we'd either see somebody slowing down with speed type drills, or their weights might decrease in the gym possibly, or they just won't be playing well. They might have chronic fatigue, apathy, so they just don't care. Maybe a loss of appetite, some stomach issues like indigestion, weight loss, and inability to sleep or rest well. So they may be complaining of sleep issues. Stale athletes become irritable and restless, so they're just kind of nasty to be around. And they're at an increased risk for acute and overuse injuries and infections. So we tend to see infections like colds and things like that kind of run rampant through teams when they're at a period of high training where a lot of people are starting to become a little stale. Next, we're going to talk about burnout. So burnout is like this guy in the little picture down here, whose battery is just on 0. He's got all kinds of things to do. He's spilling his coffee. He just can't win. It's just a bad day. So with burnout, this is a syndrome related to physical and emotional exhaustion, leading to a negative self-concept of the person's self, their job, their sports, a loss of concern or for feelings of others. So, people who are burned out, they just don't care. They just don't, like, they're over it. They just can't do that. They just can't do it anymore. So it's a lot more emotional than staleness is. Burnout can stem from overwork and can affect an athlete, a coach, an athletic trainer, a physical therapist, a personal trainer, anybody who's feeling really stressed out by the demands of their work and their life. It can impact your health. There can be some physical things with this. So you can get some headaches or intestinal disturbances or sleeplessness or chronic fatigue. But mostly the person will feel depersonalization. So again, they just don't care. Like, I can't, I'm so stressed out that I just can't care about how you feel right now. It's kind of how they're going to feel. They're going to have increased emotional exhaustion, a reduced sense of accomplishment, cynicism, and depression. So again, burnout is more emotional and staleness shows more physically. So again, with staleness, we're going to be more likely to get sick more easily. They're going to have more heart palpitations and things like that go along with anxiety. With the burnout, it's just the person just doesn't care anymore, basically. On this slide, we're going to talk about using goal setting as a motivator to rehab compliance. Athletes are pretty good at goal setting and using that as a motivator because athletic performance is based on working towards and achieving goals. So with athletic rehabilitation, athletes who are aware of the goal and what must be done to accomplish that goal are more likely to attain it. Goals must be personal, internally satisfying, and jointly agreed upon. So I have this little picture over here of the physical therapist or athletic trainer measuring this girl's range of motion with a goniometer, and that's a common goal we'll have for say for instance knee rehabilitation is to get full extension with the goniometer. We want the extension to be complete and full flexion. And as physical therapists or athletic trainers, that's great, but the athlete doesn't care about that. They don't care what their numbers are necessarily. But so for them, it's not going to be personal or internally satisfying. But if we tell them, if you have full extension, it's going to be a lot more comfortable for you to walk with your knee, or if you have full flexion, it's going to be a lot more comfortable for you to ride a bike. That is more internally satisfying for an athlete than just telling them what number we want them to hit. So to better attain goals, we should use goals we should use positive reinforcement. So giving them something for that goal, even if it's just, oh, you met your goal of your full flexion of your knee. We can do leg press now. So some type of progression with their rehab even could be a positive reinforcement. We want to use time management for incorporating goals into their lifestyle. So when we're asking people to do home exercises, we want to be mindful of the fact that somebody's not going to do 16 home exercises every day. If we ask them to do 4 home exercises 3 times a day, that might be possible. The other thing we can do is make suggestions for times that might work. So saying if we want them to do exercises where they lay down, asking them to do them when they wake up in the morning and when they go to bed at night. That can help people kind of visualize how they will do that with their lifestyle. We want to give them a feeling of social support and a feeling of self-efficacy. So even if we ask somebody to do their home exercises 3 times a day and they only do it twice, yearly, it just depends on the person's situation and kind of where they're at in their rehab. Usually within a newer post-operative rehabilitation, we're going to have weekly goals, and then after that, it's going to go more towards monthly. So we do want to try to do our best to provide social support to the injured athlete. The coach and or athletic trainer is often one of the first people to interact with an athlete following an injury. Same thing with a personal trainer working with a client. We want to show the person that we care about them as a person, as well as an athlete or a client. And the athlete must respect the coach or personal trainer before trusting him or her. So the way we get people to trust us is first by being a good listener. We want to make sure we're doing active listening. That's a critical skill. So we're going to listen to the athlete beyond complaining and try to hear what they're telling us, not just what they're saying. So if somebody's saying, my back hurts, I'm never going to get better, blah, 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 we're not going to sit there and be like, oh, this person drives me crazy. All they do is whine. We're going to pay attention to the emotions they're expressing with what they're saying. So that person is most likely telling us that they have anxiety, or that they're having some depression surrounding that injury, or they're having fear that they're never going to get better. If we can listen to those things, we can actually help the person get better faster. The other thing we want to be aware of is our body language. We must be concerned and look the person in the eye with genuine interest. That helps develop trust and respect. I know this sounds stupid, but if you can tell somebody's not interested in what you're saying, you're not going to trust them. So this is a little kindergarten graphic that I borrowed from my son's school. To be a good listener, our eyes are on the speaker, our brain is thinking about what is being said, our ears are listening carefully, our mouth is quiet, our hands are still, and our feet are still. If somebody's talking to us about something really important, like an injury that they've had that they feel is going to affect their life in some way, then it's important to give that person your full attention. It helps them to understand that you're listening and that you care about them. Some other ways that we can provide social support to an injured athlete or client are to project a caring image. So we can do that by establishing a rapport ahead of time, hopefully, and showing a genuine sense of concern. So not being snarky, we can joke around with people, but at the same time, you want to actually act like you care about them. We want to do our best to treat the athlete or client as an equal partner. This will help the person take ownership and accept responsibility for rehabilitation. I often do this just by asking somebody, what machine would you like to do next if there was more than one option? Or, maybe if we're short on time and we're going to have to skip something, I'll ask, would you rather do lat pull downs or rows today? Just something as simple as that can help the person take some responsibility for themselves. Telling them, when they come into the physical therapy clinic, what we do here is really important, and it is going to help you get you to feel better. But if you're not doing your home exercises at home, you're not going to get better like you could otherwise. If you are doing your home exercises, you're going to help heal yourself. Those things will help the person take ownership. Neglecting an athlete or client will make them feel like an outcast, and that could contribute to injury or re-injury. Some coaches will limit contact with other athletes until the athlete has returned to play. I really hope this doesn't happen as much as it used to, but who knows? Some people are like that. But this can cause major adjustment difficulties for athletes suffering from serious injuries. Some coaches will even refuse to talk to athletes or tell others that an athlete isn't tough enough or doesn't want to play when they're injured. Especially if this is done in front of an athlete, or if somebody else tells that person that the coach said that, it's going to create a lot of problems, and it's just not worth it. It's not worth talking to other people about that. An athletic staff member will either support an athlete and gain dedication, or they'll undermine the athlete's trust, setting the athlete up for failure when they return to play. Some other ways that we can provide social support is to find out what the problem is. So when somebody's upset or somebody's having a hard time with dealing with an injury, we want to allow the athlete or client the ability to discuss their injury and being a good listener, and try to take all sides into consideration and discuss the situation with an athlete. It's better for somebody to understand what their status is after returning from an injury ahead of time. So people usually deal with stuff better ahead of time, instead of it being a surprise. So if there are two quarterbacks, say for instance, and on a football team, and one quarterback gets injured and the other quarterback is taking over, and the injured quarterback automatically assumes they're going to get their starting position back, and that's just not the case. It's better for that person to know what to expect. Now, if the coach tells them, oh, if you work really hard in your rehab, then you can earn your spot back, and then they don't have any intention of doing that, then that sucks. That's not okay. I think it's important for that person to understand what their status is going to be after they're healed. To the extent that you can, try to explain the injury to the athlete. Obviously, as a coach or a personal trainer, you wouldn't necessarily know how to do that. As a physical therapist or athletic trainer or physician, then we can do that. So we'll want to make sure that the athlete understands their injury clearly and the circumstances surrounding it, and basically has some idea of how long it's going to take them to get better. We want to provide a clear and simple explanation. So it's best to use more layman's terms or teach the person what technical terms mean, as opposed to only using technical terms when we're speaking to an athlete or a client or a patient. An athlete's perception of the severity of the injury will affect their rehab process more than the actual severity of the injury. I have a patient right now who just, I die when I see her, because it is the end of the world for her that she has 2 out of 10 pain. What? I wish I had 2 out of 10 pain throughout the day. I have a lot higher than that right now with my back pain. But for her, it's the end of the world that she has 2 out of 10 pain. It completely wrecks her day. And so her perception of the fact that that's, even though she knows that's a low level of pain, her perception of how bad that is in her life is affecting her rehab process, because it's basically ruining her day. It's making her frustrated. It's making her feel like she's not progressing. So again, the actual amount of damage is less important than the person's perception of it, or the amount of pain is less important than the person's perception of it. Other ways that we can help an injured athlete is by managing the stress of the injury. So stress associated with not playing and the meaningfulness of the sport to that athlete can dictate the rehab process. So oftentimes rehab is more successful if the athlete is fully engaged in the process. And we can do that by, allowing things that are familiar. So trying to make exercises feel familiar to the athlete, maybe similar to what they would do in the weight room or on the field, or allowing them to do what they can in the weight room. I've had patients who were on crutches who love to work out, so I'd send them to the weight room. I just tell them, use your crutches. I want that to be a red flag to somebody, not to knock you over, to run into you, but go lift upper body. If you can't do legs, go lift upper body. Stress can be a deterring factor for getting better or participating in rehabilitation. And we can use various stress reduction techniques as well. So there's lots of different things we can use to help somebody reduce their stress and or reduce their perception of pain. So we can use imagery, so imagining themselves as they want to be, possibly, or even, there have been some really great studies on healing from cancer. And if people imagine that their body has these little fighter spaceships like Star Wars that are going through and they're blasting the cancer cells whenever they get chemo, if they're sitting there imagining that as they're going through chemo, that all of the medications are going to be blasting all the cancer cells and killing them and making them better, the chemotherapy actually works better. Another thing you could do is relaxation and cognitive restructuring. So that's literally just changing how you think about your pain. If you think about your pain as a sensation versus something that's ruining your life, that's really different. Another thing you can do is thought stopping. So I have a patient right now who really needs that thought stopping. For her, she starts to spiral. She starts to think, this pain is so severe, it would be better if I didn't have to live with it at all, if I didn't live at all. And so for her, she just needs to say, no, that's ridiculous. I'm going to get better. And that's thought stopping. So you just say, no, that thought is not acceptable to me. I'm going to think differently. That's thought stopping. Also, modifying the athlete's perception regarding the injury could have a very positive impact on the rehabilitation process. I've seen that time and again, and it's actually so important to our surgeons that own our physical therapy clinic that they actually have run about 6 weeks or more of continuing education courses for us on this particular method of helping people with their rehabilitation. Another way we can support the injured athlete is to keep them involved with the team. So say for instance, for the individual who had the 2 ACL surgeries in 1 year, who also had problems with depression, her mom actually called me after her second surgery and told me she was concerned about her, and she was really worried about how she was going to deal with the career terminating injury. And so in as much as I could, I actually talked to the coaches about it, and they ended up making her a volunteer assistant coach for her position. So that's one thing that often happens for people who've had career terminating injuries or long-term injuries. So that was our way, or that was their way of keeping that person involved. An athlete can begin to struggle socially when they've been injured because a lot of times their teammates are their main social group. And they also might feel that support from coaches and teammates is absent because they're not able to perform how they usually do. Things are different now. So it's important for coaches and teammates to try to work to help them maintain that sense of belonging. Different ways we can help them with maintaining their identity with rehab is to incorporate sport-specific drills when we can. So if I'm having somebody who's a basketball player do single leg balance with a ball toss, I'm going to use a basketball. I'm not going to use a soccer ball. That's not their sport. We should be using the ball that goes with their sport. It helps them identify more with what's going on and how it's going to help them. Another thing that I used to do for rugby especially is I would do the part of the rehabilitation that I had to do with equipment and things in the athletic training room, and then I would do whatever I could actually at practice. So I would oftentimes have people do rehabilitation exercises while the rest of their team while the rest of their team was doing something that patient couldn't do or that athlete couldn't do. So I might have, if they could do warm up, they'd do warm up, and then they'd come back to me and do their rehab exercises when they couldn't do running drills, say for instance, with the rest of the team. Rehab is often more tolerable if aspects of sport are incorporated. So to the extent that we can, again, we want to try to incorporate some of those aspects of sport as long as it's not going to hurt them worse. Next, we'll talk about helping the athlete return to play. So there's a couple things to consider here. First, we want to consider the athlete's perception. So sometimes athletes are ready to return physically, but they either are not allowed to by the coach or the doctor or the athletic trainer, or they can be forced to return too soon before they feel ready. A coach should assist an athlete and provide facts, again, making the situation less cloudy. So if the person is not going to be returning to their starting position, they need to know that. If they are so much better than the other person who plays that position that even if they're, rusty and returning from being out for a while, then they should know that too, that they're going to be able to return to that position. Sports and identity often become intertwined, especially when athletes have played a sport for a long time. This can also be the same for people who are just active, but athletes are definitely the worst. Specifically, certain athletes, especially endurance athletes, it can be really tough with them. But the athlete may have a difficulty with dealing with their new culture. So again, if they're returning to the team but not returning to their same position, that can be kind of difficult. And it can be difficult for them to determine their place in that new culture. Next, we're going to talk about return to competition decisions. So this can be a difficult decision. It's not always, has the person met their 4 weeks after the, grade 2 ankle sprain and they are automatically allowed to return to play. That's not at all what happens. Really, the more important thing is, when is it safe? When is the person going to be able to play without the concern with re-injuring themselves? So the athletic trainer and the physician need to be a part of that process. If an athletic trainer or a doctor removes an athlete from play, a coach cannot return that athlete to play until they are cleared by that athletic trainer. It's not okay. Even if it's a minor or a child, even if the parent says the athlete is okay to play, the athlete may not return to play. I've gone through this with some coaches before. An athlete needs to be ready to return psychologically as well as physically. If the person has a fear of re-injury, we want to help the person overcome that fear, because people who play scared are more likely to get hurt. If you remember at the beginning of the lecture, we talked about that a little bit. As far as playing in pain, an athlete versus a non-athlete is going to feel differently about this. So athletes are more often willing to play through pain, whereas oftentimes a non-athlete would prefer to treat pain prior to returning. So it's not that somebody's going to be completely pain-free before returning to sport, but their level of pain should be low and should remain low while they're playing or while they're doing their activities, and it should not get worse afterwards. If somebody is playing with a lot of pain and they continue to have more pain afterwards and they continue to play on that, they could do long-term damage. Pain for an actual injury that's a specific injury is an indication that something's wrong. It's one of our signs that something is wrong. It doesn't mean we want, again, that to ruin our life or ruin our day, but we do want to pay attention to it. The sensations that are coming from that injury are giving our brain some information. Athletes will often look at the present and the rewards of competition, as opposed to down the line, like what can happen if their injury worsens. So, for people who, say, for instance, chronically dislocate their shoulder, I can't tell you how many surgeons I've worked with who have told people, who've dislocated their shoulder 8, 9 times, if you want to continue playing your sport and doing this to your shoulder, that's kind of up to you. But if you want to hold your children when you have kids, you may want to reconsider what you're doing to your body right now, because that's what it comes down to sometimes. It really does. The person's daily activities will not be what they need to be when that person is 50 or 60 years old, if they're hurting themselves so much at 20. But it's hard, but all 20-year-olds are invincible. So it's hard to understand that until you get older. Some other things as far as return to competition decisions. For return to play decisions, the athletic trainer or the doctor will determine the status of the athlete's injury, but the coach determines the status as far as their position and the game situation. So I used to have a coach that I worked with who liked me to tell her exactly how long I thought somebody was going to be able to play in a game. Well, that's kind of ridiculous, but whatever. I played along, and so I would tell her that. The next coach I worked with at University of Michigan, one of our first scrimmages, I tried to tell him how long I thought somebody was probably going to be able to play with their rotator cuff strain. And he looked at me and he said, I just want to know if they can play or not. I want to be able to decide how much they're playing. You tell me if they can play in the game or not, and I decide where, and when I will use them. And that was actually fair. That he was right. That was his job. The other coach was having me do something kind of weird. But if I were to tell him she's, I don't think she's going to last for very long. She'll be done when she's done. When her pain gets up to this level, she's done. And that was more helpful information for him than for me to say, she'll probably be fine for the first half, but the second half will be a problem. So the game status and the game situation is the coach's decision. If somebody returns to play too soon, that can cause a re-injury and a longer absence, which may reinforce a coach's decision to play someone else. So we, as healthcare professionals, we do need to try to be accurate when we can as far as letting somebody return to play. Poor performance in a competition could illustrate that an athlete is not ready to return to a coach. It could be helpful for us as athletic trainers too. If we see somebody limping around the field, we generally pull them off. Again, utilizing benchmarks or baseline performance data could aid in that decision-making process. So again, going back to our functional testing. So if we have functional testing like ladder drills or shuttle runs or something to base some of that information off of, that would be really helpful. If we can use the pre-injury and post-injury scores to assess that person's readiness. Rehabilitation of athletic injuries is more than just physical, emotional, or psychological. There'll be aspects of it that are environmental. It's going to depend on the support of the athletic community and as a whole and of that team, and the culture involved with participation in sports in general. And each sport's going to be a little bit different about how they accept people who are returning from injury as well. Last but not least, in the psychological help lecture is referring the athlete for psychological help. A coach or an athlete or an athletic trainer or personal trainer is often the first to notice that an athlete or client is emotionally stressed. We can sometimes see changes in personality and performance that can be an indicator of needing a change in the training program, but then also sometimes we just need to help refer people for more help. Athletic trainers and coaches should be aware that we do have a role to play as far as counseling the individual, but we're not psychologists. We can help somebody try to deal with their emotions and conflicts and personal problems, but we do not have professional counseling skills. If somebody is having, chronic or clinical depression or showing signs of bipolar disorder or severe anxiety, we have to refer them for help. But we do have to have skills to help people deal with their frustrations and fears and crises, and we have to know who we could possibly refer somebody to. So if you're an athletic trainer or a personal trainer or a physical therapist who doesn't have a psychologist, say for instance, to refer somebody to, then you refer them to their primary care doctor. So I think it's really important that you go talk to your doctor and see if they have, somebody that they can refer you to for help. One patient in particular is having just a really hard time in general. It's really affecting her rehab for her back pain, and we referred her to a pain management clinic actually, and they're doing an outstanding job with her. They've referred her to a psychologist that works in their group, and she's actually starting with group therapy soon. And I'm actually really excited for her. Her pain has come down 2 pain points in the last month just because of starting with this pain management group, and she's not even taking medications. She hasn't gotten one injection. They haven't actually done anything physical to help with her pain. All they've done is address her psychological and emotional issues surrounding the injury. Again, that team physician could play a role in treatment as far as psychological help. Or again, if the person doesn't have a team physician, it would be their primary care physician. Many psychological responses thought to be emotionally related could be caused by physical dysfunction. So depression, say for instance, that is a physical issue. That's not an emotional issue. That's a chemical issue that happens in the brain. Fibromyalgia can also cause psychological problems. Alzheimer's could cause emotional issues. Interestingly, gluten intolerance can actually cause some fogginess and symptoms that seem similar to depression. But physician and psychologist referrals should be routine for people that are showing us that they're having a lot of problems. I haven't referred that many people to psychologists, but the people that I have referred actually really appreciated it, and it helped them a lot. And if somebody chooses not to go, then they choose not to go. I had a patient who was having a really hard time dealing with a fairly severe knee injury. He's a Pacific Islander, and I don't think that accepting help from a psychologist is something that was really a part of his culture that would be acceptable for a man like him. And so I actually did refer him to psychologists. I tried to get him to go. He chose not to, so I just did my best with what I had, did my best to help build him up, build up his self-esteem, get him out of the house, get him working out again. He had just been sitting in a recliner, really not doing anything to help himself feel better after his knee surgery. And I got him up off his butt and told him, "What are you doing? You're not dead. Go out and do something." And I got him back. I helped him, encourage him to get back into the gym. I encouraged him to go do social things with his girlfriend, and I think it really helped a lot. And I would have preferred him to go see a psychologist to try to work through some of it, but I think that just us working together and me being there to help support him really helped him get through a tough time. I wasn't a professional psychologist, but I was able to help him a bit as far as his frustrations and fears. And that is the end of our psychology lecture.